The word crisis gets used a lot these days, probably overused, but it's the only word to describe the devastations being caused by the vast amounts of illegal fentanyl pills that are flooding across our borders. 50 million pills were confiscated last year, and that's just what's been stopped. Now, Oklahoma doctors are sharing a new public service campaign to get the word out that one pill can kill. We're speaking today with Dr. Donald Kyle, who is a professor at OSU and has a PhD in synthetic organic chemistry, and Dr. Kelly Dunn, MD, an addiction medicine physician at the OSU Addiction Recovery Clinic in Tulsa. Dr. Dunn, let's begin with you. Tell us what you're seeing at your clinic as a result of this fentanyl crisis.
You know, it's hard to test for fentanyl in the clinic. We have to send a lot of it out, but we're seeing a much higher number of urine samples that have fentanyl. And in fact, when we tell our patients, a lot of them did not know that they were exposed to fentanyl. So they're very surprised, genuinely surprised, that they had no intention of ingesting or using fentanyl.
And Dr. Dunn, how much fentanyl are we talking about? I mean, these are just minuscule amounts, correct?
The lethal dose is very small. So, you know, they're lucky. And I tell my patients that they're very lucky to be sitting in front of me after using any kind of fentanyl, because it doesn't take much to unfortunately kill somebody.
Dr. Kyle, tell us more about the One Pill Can Kill campaign and how you intend to roll it out.
I think most people may be aware, for example, that last year the Centers for Disease Control reported a record high number of drug-related overdose deaths in the United States, approaching 108,000 people. Of those cases where opioids were involved, about 75% of the time, fentanyl was the culprit. And the main driver of that is the manufacture and distribution through e-commerce primarily of counterfeit prescription medications, including Adderall, Xanax, and Percocet. The tablets look very similar, but they're not. So we feel that the One Pill Can Kill is a great message to get out that can save lives.
I also noticed 10,000 pounds of powdered fentanyl. And again, that's just what has been found. We're seeing this everywhere across America in all kinds of communities. Isn't that correct?
You know, addiction was already a disease that didn't really discriminate by socioeconomic class or racial or ethnic background. And this holds to be true for fentanyl. It's really affecting everybody. And we're seeing kids, adolescents, teenagers going to their first party, you know, taking a tablet looks just like one that you would get at a pharmacy. And that's all it takes for them to stop breathing.
I guess the question is, what's the game plan for at least slowing this down? I imagine we're talking about, you know, participation and cooperation from various entities, Dr. Kyle.
The game plan is, I would say, it's a work in progress. You know, this is an emerging problem that's nationwide. It's an extremely dangerous time to be experimenting with drugs. If something hasn't been prescribed to you specifically, you should not be taking that. And even if it is prescribed for you, and you should be absolutely trusting that that tablet is what it says it is. Narcan is by far the gold standard for reversal of an opioid induced overdose. And historically, it's worked very well against things like OxyContin, oxycodone type things, or heroin. But fentanyl is a new generation of synthetic opioid, and it's at least 100 times more potent than morphine. It can reverse a fentanyl overdose, but it oftentimes requires multiple Narcan injections. And the first responders may not always have multiple injections available. Fentanyl lasts in the bloodstream several hours longer than Narcan. Within a few hours, the patient could revert back to the overdose situation when the Narcan wore off. For that reason, one of our research projects at the National Center for Wellness and Recovery is to design and develop longer lasting, more potent reversal agents than Narcan.
Dr. Dunn, what's your message to parents? What can they be looking for in terms of behavior if they fear their children may be experimenting with this incredibly dangerous drug?
The answer I would give you is I wouldn't wait to notice behavior to talk about this because you could be too late. So don't wait for suspicious behavior. Talk about it now. Let it be a dinner time topic. Talk about Narcan. Tell them how to use it. Get it in your house. In our clinic, we get it in everybody's hand, whether they struggle with opioids or not. Now, other signs and symptoms that you might be concerned about is just changes of behavior from their normal, which I know can be sometimes difficult to tell with teenagers. But, are they isolating more? Do you find that they're more sleepy? Are they having changes in their grades? Maybe they're more angry or irritable. But it's definitely too late to wait for those kinds of things to be talking about this with your kids.
A lot of tremendous information, kind of scary information, but thank you so much for your time, Dr. Donald Kyle and Dr. Kelly Dunn. Thank you so much.
Thank you for taking the time to talk to us and to share the message. It's really critical for Oklahomans.